Good morning, everyone. My name is Collyer Smith, and I head up our Rotary District Mental Health Initiative. We are in the process of having a huge event on Saturday and Sunday and through beginning of April on bringing the awareness of the mental health issues surrounding our youth and as well as younger generation. I'm very excited and we feel very fortunate to have Michigan Supreme Court Chief Justice Bridget McCormack to address some of the mental health issues that she's faced in with the leadership of the judicial system. And as well as we have Laura Heineman, who is with the board of directors of the Rotary Club of Ann Arbor, one of the largest Rotary clubs in the world, and there are over 35,000 Rotary clubs. So let's begin. Thank you, Chief Justice Bridget McCormack, for joining us today. We would like to get your input on the judicial system and your leadership as far as with regards to the mental health issues. So let me start by asking a question. As the co-chair of the Michigan Joint Task Force on Jail and Pretrial Incarceration, can you share with us how you've been able to resolve entrenched problems in the use of jails as it relates to mental health and substance use issues?
Yes, well, first of all, thank you very much to the Rotary for your leadership on this issue. I'm really grateful that you are going to be focusing on mental health, and I am eager to partner with you in any way I can. So I'm very happy to be here. The pleasure is all mine. And let me just frame the conversation a little bit so people understand why a judge is even involved in issues like this. In Michigan, the Supreme Court, which is made up of 7 justices, has administrative oversight of all of the courts of the state. And Michigan has 242 trial courts, over 500 judges. They hear between 3 and 4 million cases every year. So it's in those trial courts where a lot of people who are struggling with mental health concerns or substance abuse disorders end up interacting with the judicial system, not usually in the Supreme Court. Very few cases go to the Supreme Court, but a lot of cases involving people struggling with mental health and substance abuse disorders end up in local trial courts. And through our leadership, we can support the courts in how they can help people, families, and communities who are struggling with those issues. I also have had the pleasure, and I'm finally getting back to your question, I apologize for my long-windedness, but I have had the pleasure of co-chairing together with the Lieutenant Governor, the Governor's Task Force on Jail and Pretrial Incarceration, which was a 3-branch effort. The leaders at the legislature and myself and the governor entered into, also together with the sheriffs and the county governments, entered into an agreement with the Pew Charitable Trust to staff us, which was amazing because Pew does great work, to try and figure out what was driving our increased jail populations in the state. Michigan has 83 counties and 81 county jails and 81 IT systems for keeping track of who's in those jails. So it was a hard problem for us to get our arms around without some help from folks like the folks at Pew. But we knew we wanted to do something about it because even though crime was at a 50-year low, our jail populations had tripled over the last 30 years. And it wasn't clear that we were getting a good return on our investment. It wasn't clear that the rising jail populations were making our communities any safer or any healthier. So we wanted to try and better understand what was driving those jail populations and then make some bold recommendations for how to think better and do better with the people who end up interacting with our criminal justice system, especially this front end of the system, the people who end up in county jails. And not surprisingly, I think we all sort of had ideas and anecdotes about what was going on, but not surprisingly, a very high number of people struggling with mental health disorders end up in county jails, and often because of those mental health disorders, substance abuse disorders as well. The numbers were off the charts. But at the same time that our jail populations have grown over the last 30 years, we have also divested from, I guess is a better way to say it, from mental health services in our communities. And so we've made police officers and deputy sheriffs are frontline mental health workers in many of our communities. And families and people with loved ones struggling in a mental health crisis often don't have anyone else to call. And then the responding officers don't have anywhere else to go but county jails. So the number of people with serious mental illness and then with some mental illness in our county, in these expanding county jail populations, was extremely high. So we made a series of recommendations to the legislature, and a number of them are probably not within the bounds of today's conversation, but we did recommend investing in diversion, deflection, and mental health treatment for people who are struggling with mental health disorders, and that was the primary reason they were coming to the attention of law enforcement. This is one of these issues that different counties do differently, and counties with more resources are already doing better than counties with fewer resources. And Michigan's a big state, and there are lots of counties with not significant resources, and jail is the only place right now where where officers take people struggling with mental health and substance abuse disorders. That doesn't help, right? Because you send them to jail and they come out of jail in some number of days and they still have those same underlying problems.
With the problem-solving courts, can you address the underlying issues like mental health and substance use issues, how the problem-solving courts are addressing it?
Yes, we are very proud of our problem-solving courts in Michigan. I believe we have 199 treatment courts in Michigan. Anybody in any part of the state who needs one can now access one, even if there's not one in your specific county. We have a number that operate regionally so that we can make sure anybody who needs one can access them, which isn't to say we couldn't use more funding for them. We could even serve more people. But the problem-solving court model is one that, frankly, some brave judges about 3 decades ago decided to try without any data, because when you start something new, you don't have any data to show that it works. But it was their hunch that for people struggling with substance abuse disorders or mental health crises, sending them to jail or even prison without treating the underlying issues that got them to court in the first place, that had them interacting with law enforcement in the first place, was short-sighted, because they'd be released and they would come back. And there were a number of judges seeing the same people cycling through their courtrooms and without ever addressing what it was that was driving their interaction with law enforcement. It felt to these judges like they could do better. And so the problem-solving court model is one where instead of sending someone to jail or to prison, somebody who wants to engage in trying to get help for the underlying issue that drives their interaction with law enforcement is connected with services and put into a community of other people also working to address similar issues. And the judge and her treatment court team or his treatment court team run their courtroom more like a meeting every week. I've been to a number of treatment court graduations and just regular check-in meetings. The judge is never on the bench. She or he is always down in the well of the courtroom, and the community is one of people supporting one another with sobriety or mental health treatment. And it is a big commitment, both for the court staff and for the people who agree to try and make it work, the participants. But the success rates you can't argue with now, because now we have 3 decades of data, and people who successfully graduate from treatment court programs are far more likely to be employed, far less likely to be rearrested, and more commonly are able to contribute to their communities, their families. It's a success story across the board. It's a different model from how we think about the criminal justice system. It's a restorative model, but it's one, frankly, that works.
Thank you for sharing those successes. And now I'll turn it over to Lauren, who has some questions as well. Lauren?
So we'd like to talk about social media regarding free speech versus hate speech and mental health. From your perspective as Chief Justice, how do we draw the line and what can we do as a community to manage through this?
I think that's a great question, and it's actually one that you know I don't have an easy answer to, because the problem with free speech versus the kinds of speech that cross a line, such that we would allow the government to regulate it, is a question that courts basically struggle with all the time. And there's not, you know, each example has to be weighed against the constitutional protections that we as, you know, Americans care about and are enshrined in our Constitution, versus when there's some speech that's dangerous. I happen to believe that we shouldn't leave it just to the government to figure out what those lines are and what we want to expect from our neighbors and our community. And I think probably the better way to figure out how we want to interact with one another and where we want to draw lines is if we do it within our schools, within our community groups, within our other supportive places in our neighborhoods and our non-government facing, you know, organizations, where we can set good examples and help people interact in ways that are positive and not negative.
Can you also share your work with the Regional Judicial Opioid Initiative? How can we as community leaders help?
Yeah, thank you very much for that question. The Regional Opioid Initiative, Judicial Opioid Initiative, is a wonderful program where 8 states that are in a certain region have connected the judges in that region that are running treatment courts. So the judges who work in treatment courts in Michigan and Ohio and Indiana and Illinois get to share best practices and learn from one another. There was a you know, judges are people, we're human, and sometimes we don't know everything, believe it or not, and the judges running treatment courts have a lot to learn and to share with each other. And so it has been and still is a successful way for judges to interact and share best practices and things that are working that we might not have tried yet in Michigan, but we should try. So for example, when medically assisted treatment first became recommended, there were judges who were resistant, and it helps for them to hear from other judges that this is a successful way for people to be sober, and sometimes hearing it from other judges is a better way to learn than from some doctor who comes and tries to tell you what's right. So it's a way for judges to share resources and training and materials. And it's been incredibly useful for our judges in Michigan who both exported good lessons and learned some good lessons. And we have a number of judges who participate in it. I feel like your question had another piece to it. Oh, what can you do in the community to help? So I love this question and I really appreciate it because I think everyone in Rotary cares about their community and is active. So I feel like I'm speaking to a great audience right now. And the answer is you can advocate for your courts to expand, if they already have treatment courts, to expand the number of places they have for people in those treatment courts. Or if they don't have treatment courts, you can tell them you want them to have treatment courts. You can advocate with your local court system to say, we want a restorative process for people struggling with mental health issues and substance abuse issues. You can also advocate for your local law enforcement, your sheriff. In Washtenaw County, you already have a sheriff who is a national leader in this, but you can advocate for your law enforcement to work together with your judges and your public health department and your medical health infrastructure to address substance abuse disorders and mental health disorders in the way they need to be addressed. Law enforcement, the decisions about what is illegal and how to enforce what crimes are on the books are political decisions. So your community can say, we think it's a better option to make sure we get people treatment than to traditionally enforce drug possessions, for example, or the kinds of infractions that mental health crises often cause. You get to decide, right? Your elected officials should be carrying out the values that you care about. You can advocate for them to work together to address behavioral health issues with appropriate solutions.
Thank you, Chief Justice McCormack. Any final comments that you'd like to share before we wrap up?
Just, I think I'd love to finish where I started, which is I'm so grateful to Rotary for your leadership on this topic, and frankly, so many others. Thank you for being engaged in your community and caring about each other.
Well, thank you for your insight, your feedback, and your obvious leadership. Thank you very much for your time today. If you would like to learn more about our big event, go to www.erace.thestigma.com. We'll be very excited to help and support this community-wide initiative. Thank you, Chief Justice McCormack. Thank you, Lauren, for joining us today. Have a wonderful rest of the week.
Thank you.
Thank you.